In this video, we will be providing an overview of the libraries management in the Utilities section of the Oncology Information System. The libraries contain information used within the system, including standard code sets, specific to their respective aspect of medical and radiation. Each library is displayed in its particular dialog and presented as a selection list to populate fields in numerous dialogues related to specific the OIS functions. Each library, such as appointment status, contain library tables. The user can add, delete, and edit tables for all libraries, with the exception of tables that are grayed out, which cannot be deleted or edited. The color associated with an item may be edited by double-clicking on the item's color, then selecting the new color. The Activities library allows you to manage activities for scheduling. Again, you can view, add, edit, or delete the activities that are not grayed out. Appointment Status library allows you to manage the appointment status for scheduling. Department library allows you to manage departments to assign user accounts, patients, and captured codes. Diagnosis code allows you to manage the diagnosis code library, which contains the WHOICDO3 codes for the ICD-9-CM code. Diagnosis confirmation allows you to manage the diagnosis confirmation library. Diagnosis group allows you to manage the diagnosis group library. Diagnosis type provides you with the diagnosis library for adding patient diagnosis information. The distant mets library is for different patient areas containing metastases. The dose spec, or dose specification, library is used to select a dose specification for the prescription site to be calculated. External physician allows you to enter information for physicians that may not be in your facility, such as a referring physician. Select specialty type in drop-down list, which includes ENT, general practitioner, gynecology, medical oncology, neurology, pediatrics, primary physician, radiation oncology, surgery, urology. You can also check or uncheck the active box. If you uncheck the active box, the external physician is not in the list when you add information about referring physician. HP grade, or histopathologic grade, is used to classify cancer cells in terms of how abnormal they look under a microscope and how quickly the tumor is likely to grow and spread. Many factors are considered when determining tumor grade, including the structure and growth pattern of the cells. The specific factors used to determine tumor grade vary with each type of cancer. The intent library is used to select the objective you are trying to achieve by administering the treatment plan. The laterality library is used to specify the tumor position. Laterality refers to the side of the body and applied to the primary side only. Laterality for an unknown primary site should be recorded as not a paired site. Note, this field is not intended for a metastatic site. Location is used for the different treatment devices, such as a LINAC or a cobalt machine. The lymph invade library is used to select the extent of lymphatic system invasion. Standard choices are 0, 1, 2, and X. The Morphology Codes library provides a listing of the WHOICDO morphology codes used when entering patient diagnosis and staging information. The OIS allows you to manage morphology group library. If required, you can update the morphology group too with more suitable information. Note category allows you to manage category of the notes that are added in the OIS. Note status allows you to manage the status of notes that have been added in the OIS. The pattern library is used in scheduling and can also be managed. The patient status library is used in scheduling and can also be managed. The procedures library is used to add or import procedures for scheduling and administrative codes. This library is based on standards for different countries. The Physician Specialty Library is used for adding information for an external physician. You can manage the Physician Specialty Library and the physician specialty which exist in this library to appear in the specialty list of the external physician. The Stage Library is used to select the tumor stage grouping. Carcinoma in situ is categorized as Stage 0, and cases with distant metastasis are categorized as Stage 4. The Stage Basis Library is used to select how the tumor was staged. Standard choices are clinical and pathologic. However, you can add new stage bases to the list. Task Category allows you to set up categories for the different tasks that are assigned to users in the OIS. Task Status allows you to set up the status for tasks that are assigned to users in the OIS. The Technique Library is used to set up the treatment technique used in the OIS. The Transportation Library is used to select the suitable transportation when adding patient information. The Treatment Site Library lists all treatment site and provides a description for the respective treatment site. The Tumor Library lists all tumor grades and provides a description for the respective tumor. The Venous Invade Library is used to select the extent of venous system invasion. Standard choices are 0, 1, 2, and X. However, the list is configurable. Thank you for watching.